comment on developing, or the objective of developing healthcare systems. My experience as a clinician practicing in many locations around this country, especially after the pandemic started because of the shortage of my specialty, it's this desire for developing more resilient and innovative healthcare systems has to happen. And we need to be practicing more and more what I call true health care, not just disease management. And I'll talk a little bit more about that. So I'll focus my few comments on promoting preventative healthcare. And later on, we'll hear the valuable contributions of Dr. Chaudhry and our esteemed colleagues from the Islamic University in Uganda. Now more than ever, there is a need for strengthening resiliency and implementing life-changing innovation. There are two important numbers which keep me focused on brain health and restoration. The two numbers are 52 and 43. 52%. What that reminds me, and it's an estimate, but it's an ever-increasing estimate of the amount of physician and healthcare provider burnout. And that's in the Muslim world and elsewhere. It's catastrophic, and it's increasing, and it's taking a significant toll. And in part, that's because of the non-resilient and sometimes non-innovative systems that we have. But the number 43% is from the World Health Organization Global Burden of Disease Updated Study. 43% of the world population across all borders, all ethnicities, are experiencing nervous system disorders. And that's huge. And that leads cardiovascular disease, cancer. It's skyrocketing. And I believe there's many, many reasons for that. So as a count of all that, hospitals and clinics are overfull with increasingly sicker and sicker people of all ages. And I'm privileged to see people of all ages, from newborn into the older years, which I have now entered. But it's just overwhelming to see this happening in the burnout. In the Muslim world, and in fact, I think everywhere, healthcare providers and caregivers are understandably consumed with putting out the fires. And then what I call disease management. It's kind of all there is time to do. And then that leaves little time or energy left to give to prevention and education. There is well-intentioned lip service to exercise, eat well, don't be on screens too much, don't smoke, sleep well. And we mean well when we give that quick advice, but it's so easy to spend more time and a better investment in looking into that. So I've seen how ineffective this has been throughout the healthcare system. My ever-deepening focus in the neurosciences is healthcare and health restoration. And I do that with neurological history, neurological diagnosis, and then working on appropriate treatments that are symptom or disease, getting to the root of the problem, and then working on brain health restoration. So as I said, my fundamental conviction is that we are created as electromagnetic beings. And my journey just this last year in the Qur'an has been amazing, seeing that just how often this has been. It's just been amazing. So I'll pick up the phone and call Dr. Kaskas, and Dr. Kaskas, it's just, I'm like a kid in the candy store, but I'm not having candy now. Electromagnetic beings living in an electromagnetic universe, which is becoming increasingly electromagnetically polluted. So, and as I've been learning more and more, and from the Qur'an and Islam, that health is not just a biological state. It is not simply an absence of dis-ease. And we are, in fact, multidimensional beings, created spirit, soul, and body. Health is a divine gift and blessing, and our collective responsibility, not just as healthcare providers, but all of us, is to work with Allah subhanahu wa ta'ala to restore health where it's been lost. Health results from relational restoration. Ill health is a manifestation of relational disharmony, both within ourselves and in our relationships. And vibrant health is expressed in the soul, spirit, soul, body, nature of each human being. Health, in its fullest understanding, is multidimensional and dependent upon the integration of our spiritual health, our psychological health, our soul, our nafsi, and our physiological or our bodily health. So 2 topics I'll cover in the next few minutes and then finish. So in addition to the 3 overlapping spheres of health, spiritual, psychological, physiological, there are 4 pillars of physiological health that I've used for years. Many years ago, I called it the MEDS approach, MEDS. Move, eat, disconnect, sleep. I'll talk about that in just a minute. Spiritual health, we must cultivate spiritual health. And in Surah Sad, ayat 72, Surah As-Sajda, and Surah Al-Hijr, we're told that He formed us and breathed His Spirit into us. We must cultivate psychological and mental health. Surah Al-Araf, ayat 189 tells us we're created from one soul, one nafsi. We must continue to cultivate physical health. Surah Yunus, ayat 92, Surah Al-Mu'minin, ayat 12 to 14. We know He's created our bodies. They're not all separate, they're integrated. So the 4 pillars of physiologic health, what I call my MEDS approach. There's nothing copyrightable about it. I make up simple acronyms mainly so I can remember them, but also teach them. Move, eat, disconnect, sleep. And we give lip service to this often in healthcare encounters, but we often don't go further than that. And so moving, eating, disconnecting, sleeping. And it's far more than just eat well, exercise, don't be on your screens too much. Anybody on screens or computers today at all? And then sleep well, without addressing how much people are struggling with that. For movement, in our ever-increasing sedentary society, daily, regular movement and consistent exercise help restore and maintain health and to improve healthy longevity. Phrases like motion is lotion, movement is medicine, use it or lose it, capture some of this wisdom. For the E, eat. One of the most important factors, if not, I think, the most important factor on brain growth, development, and function is the brain-gut connectome, that huge relationship in the way we've been created. In a world with ever-increasing malnutrition, suboptimal nutrition, and environmental toxicants, and quick but illness-promoting processed foods, our nervous systems and our whole beings are suffering. For the disconnect, amidst the gifts of technology, social media, and AI, we've heard so much, we've learned so much, we're growing so much, but we're also learning about the immense damage and dangers they are inflicting across the age span from in utero on, with increasingly pervasive and invasive anthropogenic electromagnetic radiation, different than our natural biosphere. And that's something that I continue to work with. You can measure that on the brain. We've learned much in the world of radiation, and it's not going away. But as we are saturated increasingly in higher giga and terahertz frequencies 24/7, this artificial electromagnetic environment saturates our electromagnetic bodies. Sleep. We are experiencing a tsunami of what I've titled another acronym, CIRS, chronic inadequate restorative sleep. Some of you are experiencing that right now, depending what time it is in the middle of the night. Not just not enough sleep, but disruptive sleep in toxic environments. not just emotionally toxic and traumas that we're encountering, but surrounded by electromagnetic technology, which affects us, versus creating a safe and healthy sleep sanctuary for all human beings. I track these systems in my work and their attendant abnormalities with clinical history exam and with a very easily available tool of EEG and quantitative EEG, which I use daily to assess brain health and brain function. Through my career, I've emphasized preventative health care for the whole person, spirit, soul, and body. And I found that this is effective for change and long-lasting results. If we are to develop resilient healthcare systems, they must be equipped with the time and energy for.
بعد يجي واحد يقول هذاك يطلع
Okay. They must be equipped with the time and energy for providers to focus on true healthcare, not just disease management. Virtually all healthcare settings today, whether in the clinic or the hospital, are consumed, as I said, with putting out the fires, desperate to identify and eliminate symptoms, which is disease management, as good as that is, with little time or energy, again, left over to find the true causes of illness, focus on restoring health, and educate in preventative health care. The Prophet Muhammad, sallallahu alayhi wasallam, said there are two blessings which many people waste: health and free time. And you are not given anything after the sincere word of faith like health. So ask Allah for health. These hadith are a reminder to cherish and use health and free time wisely with intention and gratitude to Allah. These words urge us to build systems that protect, preserve, and promote health for all humans from conception to death and beyond.